Well, thank you everyone for joining. My name is Colleen Green and I work with Project Healthy Schools. We're welcoming everyone to the 2022 Project Healthy Schools Community Conversation. We're happy to see you all here and we hope you enjoyed the myriad of information we'll be sharing with you today. Before we start, just a couple of quick housekeeping notes. You'll see that the live transcription is enabled. You may turn it off if you like by clicking the CC box and then on Hide Subtitles. If you'd like to change the view on your screen, you can click on the view icon in the upper right-hand corner at any time during the presentation. As we have such a limited time together today, we ask everyone to remain muted during the conversation because there will be an opportunity for Q&A and discussion at the end of the presentation. However, please feel free to enter questions in the chat box at any time, and we'll get to them as soon as we can at the end of our conversation in our Q&A time. Now, without further ado, the team at Project Healthy Schools would like to introduce ourselves with a brief word from one of our founders, Dr. Kim Eagle.
Hello, my name is Dr. Kim Eagle. I'm one of the directors of the Frankel Cardiovascular Center at the University of Michigan. I'm one of the co-founders of Project Healthy Schools. This is an initiative that we began more than 15 years ago to try to serve the nutritional and physical health needs of students in Michigan. Over the past 15 years plus, Project Healthy Schools now provides wellness programming and celebration of health in over 100 middle schools in our state. We've reached over 70,000 students with important messages around nutritional and physical health. And in our studies to examine the impact of the program, we've seen significant benefit. We've seen cholesterols fall, we've seen improvement in blood sugar and exercise tolerance, all suggesting that as a result of this curriculum, we're improving the health of Michigan's students. This is our future. Thank you for joining us.
And without further ado, Dr. Kim Eagle is the co-founder of Project Healthy Schools and one of the directors of the Frankel Cardiovascular Centers at the University of Michigan. He's been committed to the prevention of cardiovascular disease through community education, preventive care, and active pursuit of better ways to diagnose and treat heart conditions since joining the University of Michigan in 1994. Dr. Eagle, take it away.
Thanks, Colleen. First of all, I want to thank all of you for joining us today. I know your time is precious and we appreciate the chance to interface with you today and talk about our work. I also want to thank all of the team members from Project Healthy Schools who are on this webinar, as well as the creators of the webinar. I really appreciate the labor that you put into a program that is absolutely vital to our nation's health, our state's health. Today, in this webinar, we're gonna hear from two of the leaders of Project Healthy Schools, one who leads the program, another who helps us evaluate the program. But I think it's safe to say that the village of people working on PHS numbers in the hundreds, and the number of organizations throughout the state is massive. And this is an example of a project that requires locking of arms and working together both at the state level and the local level, and even the block by block level, the school level, to try to understand how do we meet the health needs of our youth. And I'm just so excited. Over nearly 20 years, we've had a chance to work on improving the health of the state's kids. And this is what it's about. And I'm just delighted to be a part of it. So welcome to the webinar, and I'm going to hand this back now to Colleen.
Thank you, Dr. Eagle. And now it's my pleasure to introduce Melissa Boguslawski. She's the new program manager for Project Healthy Schools. She joined the team in July of 2021. She has 10 years of public health work, leadership experience, and involvement in conducting school-based child and adolescent programming and research. Her work encompasses considerable knowledge about building community relationships, fostering cross-sector partnerships, and strategic planning in order to improve the health and academic outcomes of all students across the state of Michigan. And Melissa, the floor is yours.
Awesome. Thank you so much, Colleen, and good morning, everyone. Thank you so much for joining us today. It's a privilege to have you all with us, and we're looking forward to having you all in this conversation with us today. So just a brief overview of our short time together. We always wish we could have more time with everyone, but we'll promise to have a lot of information for you in this hour that we have. So first, what we'll do is just give you all a little bit more background on Project Healthy Schools, and then we'll switch gears and take a look at our impact, our priorities, our vision, and our partnerships. And then probably what I'm most excited about today is the results of Project Healthy Schools when it comes to us being an evidence-based program. That data that has been developed and disseminated through multiple publications through our team at MCORRP is essential for our continued success. I'm really excited for you all to hear from Eva later this morning on all the wonderful results and outcomes that we've seen from PHS over the past 17 years. So just a brief overview on how we got to where we are. So we started as a pilot program in 2004 in Ann Arbor, and then over the next few years, we expanded to more schools in Ann Arbor, and then in 2008 expanded to Ypsilanti. So you can see on our map here just how much PHS has expanded since our first pilot program in 2004. What we have done is, like Dr. Eagle mentioned, is we've developed numerous partnerships across the state of Michigan. And as anybody knows, in school health and in public health, those partnerships are essential for the success of any program. A few partnerships that we love to highlight include our friends over at Blue Cross Blue Shield of Michigan and the Building Healthy Communities program. I know they're with us today, so always want to make sure that we give them a hello and also a big thank you for their ongoing partnership in reaching more students across the state of Michigan in our efforts as a Building Healthy Communities program. And you can also see that we not only reach students in the southeastern Michigan area, but we also have had the opportunity to work with numerous schools in the Upper Peninsula. We also have had the opportunity to work with students in Bangladesh as well as Arizona. And just to give a little bit more insight of where we are at, and of course where we hope to be in the coming years, this is a map of all the regions where we are currently in across the state with our 6 new schools this year. And those schools include Woodley Leadership Academy, Stevenson Middle School, Pathfinder Middle School, the Great Lakes Learning Academy, Grand Rapids University Prep, as well as Boyd Arthurs Middle School. And so before we get started with more information, we have a quick poll for everybody just to see what you think in terms of our outreach with Project Healthy Schools. So we'll start with our first poll. And the question is, how many students have we helped since our inception in 2004? So we'll give you all just a few minutes to take your best shot, or if you put that answer in, and then we will see how well everybody does. All right, it looks like we've got to slow down. So what the answer is actually is we have actually supported, and we're really excited to share that we have now reached over 112,500 students across the state of Michigan. So that is a number that we are really excited to share with everybody. And that is, again, with our ongoing partnerships that we have with our friends across the state. So we have reached over 141 schools within 47 counties across the state. Our retention rate is outstanding. So we have a retention rate of 75%, and that's really great for sustainability of our program and resources that we offer to our schools, school staff and students as well. And then to kind of tie in with our conversation today, we've had over 25,000 students participate in research, which again, those research outcomes are really what helps drive the ongoing success of PHS, because we continue to share the success of our curriculum and the other programs that we offer to our middle school students. So just a little bit more about our impact. So we have been published, again, with so much thanks to our team over at MCORRP. We've been published in 20 different journal publications to date. We've had over 100 abstracts and conference presentations. And then most recently, would love to highlight the most recent award from mHealthy here at the university, which is the C. Everett Koop National Health Award. And so Project Healthy Schools is part of the mHealthy team. And so that is a nationally recognized award. It's something that we're very proud of and very proud to be part of. So you can see that we're not only an outstanding program, but we are also recognized statewide and nationally from a research perspective, as well as a community facing perspective as well. So our 5 goals of Project Healthy Schools, in case you're new or just need a refresher of what we do here at Project Healthy Schools. We have 5 goals and we do a lot of work, a lot of education and programming for our students to make sure that those goals are being met. So the first is to eat more fruits and vegetables. The second is to choose less sugary foods and beverages. The third being eat less fast food and fatty foods. Fourth being be physically active every day. And then the 5th goal is to spend less entertainment time in front of a screen. And we know that's been a little tricky over the past few years with virtual learning, Zooming, everything else like that. And so what we love to do is just share a video at one of our new schools this year at Pathfinder to show what this looks like in action. So Nate, I'll hand it over to you so you can share a little bit of insight on what it might look like as we aim to reach these goals within our schools with Project Healthy Schools.
Thanks, Melissa. And just FYI for everyone out there, there is a bit of lively music in this, so you might need to turn your volume down. Just FYI.
Hi, my name is Grace, and today we are here at Pathfinder Middle School in Pinckney, Michigan. Today we are doing a food tasting with kiwi and honeydew with Project Healthy Schools to introduce kids to some new fruits.
Today we're trying kiwi and honeydew.
Honeydew most, raise your hand. Honeydew most. Kiwi was your favorite way to eat.
Awesome. Thank you so much, Nate, for putting that video together. And thank you, Grace, and all of our wellness coordinators that do this work with our schools, take the extra time to prep and cut up all that kiwi and honeydew and every other fruit that we've been able to share with our students, so far this school year. So just a brief overview of what we do at Project Healthy Schools. So we have a 5-step program that we use with our schools. And again, this is for all of our first-year schools. And then we also stay within the school for year 2. And then we'll talk about some of our new efforts with our 3rd year and beyond schools, just to make sure that we are sustaining those wellness efforts across the continuum so that schools continue to receive these services from PHS. So our first step is to build support. And that typically means us working with identified wellness champion within a school, and they work on developing and putting together a wellness team and also to develop more school support. Our second step is to assess the school wellness culture, and we do that through a tool called the HSAT, which is this Healthy School Assessment Tool, and that's a resource from the Michigan Department of Health and Human Services. The third step is that we have students or schools create an action plan, which we call a SWIP, which is a school wellness improvement plan. Step 4 is when we take all that into consideration, then we take action, and that's when we start to implement our 10-lesson curriculum. Utilize our wellness team, utilize and take a look at that school wellness improvement plan, as well as incorporate 4 wellness initiatives throughout the school year. And then our 5th step is to measure success. And again, I'm going to pass it over to Eva in a few minutes so she can show how all those measurements have turned out and the success that we've had through our program and our curriculum. So one important factor for the success of Project Healthy Schools are our partnerships. And so using a coordinated approach, using best practices such as the whole school, whole community, whole child model from ACSD and CDC, we can see the necessity not only from community partners, but also from partners who have knowledge and expertise in certain fields. So again, we appreciate our ongoing partnership with Building Healthy Communities with Blue Cross Blue Shield of Michigan. I'll speak briefly about our new partnerships with our friends at Trails. And also our colleagues at Peak, Michigan Apples, United Dairy Institute of Michigan, Michigan Fitness Foundation, and of course our multiple partners across the university. And so then where we're headed. And so if you were here for community conversations last year, you know that the team did an outstanding job of continuing services through the COVID-19 pandemic, even when students were sent home to learn virtually. And so that's something that we continue to do. Our team has done an outstanding job with digitizing our lessons and content to make sure that they're available synchronously and asynchronously, and we're constantly updating those to make sure that they're up to date. We also have developed more lesson plans that are beyond physical activity and nutrition, kind of keeping up with what the current needs are for our students. And some of those lessons include kidney health. We have a lesson on vaping, and then we also have a really great lesson on infectious diseases, just to make sure our students are continually learning, of course, about physical activity and nutrition, but also some of those other content areas that are just as important for their physical, mental, and emotional health. Our DEI initiatives continue to be really strong. So most recently, we had our curriculum, all 10 lessons evaluated by our colleagues over at the Center for Educational Outreach. We have our new wellness grant program, and just this year, in its first year of inception, we've reached 30 schools who have been awarded wellness grants through Project Healthy Schools, and those wellness grants are available for our schools year 3 and beyond. And a few of those examples of wellness grants that we've funded hydroponics, school gardens, greenhouses, smoothie bars, 5K. So there's a lot of things that we've been able to fund over the past year. And a big thank you to our team of Colleen Green, Miriam Janine, and Brad Newman for overseeing that program and it being so successful. And then our new partnerships, again, we have Trails to Wellness. And if anyone's not familiar with Trails, they provide mental health services and curriculum to schools across the state of Michigan. And also our friends over at the National Institutes of Health. And Eva's going to share more of those details in just a little bit, but we're really excited to share the partnership that we have with an upcoming study with NIH. So our future long-term goals and vision. So of course, we want to continue to expand the reach of PHS across the state through philanthropic support, grant funding, and community partnerships. Of course, to expand resources and support for our current and future schools. And to continue to ensure that PHS is diverse, equitable, inclusive of all students. So when we have an equitable, inclusive program and when we're in the school environment, that helps to have students be more engaged in school. And when students are more engaged, they typically do better academically, their attendance rates go up, and then from better attendance rates, we see better education outcomes. And so PHS isn't just beneficial in the short term with health and well-being, we can also support the academic outcomes, and then we can help support attendance rates, graduation rates, which then can lead students into being more productive adults as they continue on in development from high school and beyond. And so, of course, lastly, we're looking forward to updating our evaluation measures that align with current school-based research in partnership with the team over at MCORRP and Trails. And so before we pass it over to Eva, we've got one more poll for you all, just a little check-in to see if you can recall. And so one more poll that we have for you is just a question about our publications. And so again, to date, how many scientific journal publications does PHS have through our partnership with MCORRP? And we'll give you all just a few moments to take a stab at that question and see if you were paying attention to the presentation. All right, awesome. Well, looks like we've got majority and so great job, everyone. So the correct answer is 20. So again, we have 20 publications within the science within peer-reviewed journals in the literature, which is an outstanding opportunity for us at PHS. And so, without further ado, what I love to do is hand the mic over and the spotlight over to our colleague Eva Klein-Rogers. And so Eva Klein-Rogers is a cardiovascular nurse practitioner in the Frankel Cardiovascular Center. She is also the co-director of MCORRP, an outcomes-based research team that conducts data registries worldwide, including Michigan-based our program, Project Healthy School. So Eva, I'll hand it over to you, and we'll take a look at the outcomes of Project Healthy Schools over the past 17 years.
Great. Thank you, Melissa.
Of course.
I just got to get you maximized here and we will be good to go. All right. Very good. So let's go to the next slide. I want to start out with just explaining a little bit about MCORRP. So this is Michigan Clinical Outcomes Research and Reporting Program. This is an outcomes research lab that was founded by Dr. Eagle. Next slide. Over 25 years ago. He doesn't like me to mention it because I think it has some reference to his age. But anyway, he came from a very small school out east called Harvard Medical School and was recruited to Michigan. And as a result, started this outcomes research laboratory, which includes many different registries. So we work locally around the US and nationwide on a bunch of different projects, measuring outcomes and reporting results. And it's varied. So we have a pacemaker reuse project where we're working mostly on the continent of Africa. We have an international registry studying aortic dissections. And then we have the statewide Project Healthy Schools. So next slide. I do want to give credit to Jean DeRussell-Weston, who was the project manager for the first 16 years of the program and really started this whole project, got everybody involved, and we're now, she retired and the reins are now in the hands of Dr. Melissa Boguslawski, and we are just thrilled to be working with her as we continue with our publications and reporting results. So next slide. Our research team is actually pretty small, founded by Dr. Eagle, but Dr. Lisa Jackson has played a huge part in this. She is a professor of preventive cardiology here at Michigan, is now a full professor at the University of Alabama, and unusually so, has remained committed and still functions as a mentor and senior author on most of our publications. I'm totally in her debt for continuing in this role. Rachel Krallman is key to everything. She is the liaison between the wellness team, who's in the schools, and then the research team, where we're working principally with the data and reporting on the data. And she put together all the slides for today. So thank you, Rachel. Next slide. So Melissa already talked about this, the number of students that have been impacted, and this has increased exponentially over the years to the point that now over 112,000 students have participated in PHS. Next slide. And she talked a little bit about the main goals and the different components. So there's the education piece, There's the environmental piece, and we showed a little video about the students at Pathfinder tasting new fruits. That's an example of some of the environmental changes. And it's really our team at MCORRP that's involved with the measurement. So next slide. So this is what we focus on. And today, next slide, I'm going to mostly talk about what we've learned. Next slide. So how do we do all this? So the students fill out 2 different questionnaires. This is a standardized questionnaire that we've been using from the very beginning. And they fill this out in the fall and then again in the spring after they've had all the lessons, experienced all the environmental changes, and been involved in different activities. So we ask questions about, or the questionnaire asks questions about dietary habits, physical activity, sedentary behaviors. And in addition, both the students and their parents may opt into a wellness screening where we measure height, weight, blood pressure, resting, recovery heart rate after doing a brief step test. And also we do a finger prick where we're able to assess cholesterol profiles and glucose levels. Next slide. As of fall 2021, over 26,000 students have completed a health behavior questionnaire, and over 3,000 have participated in the wellness screening. And these are the data that we use. Next slide. Melissa already mentioned we have 20 published manuscripts in a variety of different peer-reviewed journals, including American Journal of Medicine, which is a very wide readership, and childhood obesity. Next slide. She also talked about the abstracts, and abstracts are a summary of the project, and we've presented over 70 of these at national meetings all across the United States. Next slide. A couple of years ago, our team got together and said, let's look at what we've learned. We've had, at that time, it was 15 years of PHS. So we've done a lot of measuring. We have a lot of metrics. We have a lot of data. What have we learned from all of it? This was a nice paper that was published in the American Journal of Medicine with the top 10 lessons. And I'll go through each of them now and focus on a couple of them in subsequent slides. The first one was over 30% of students participating in PHS are either overweight or obese. When students participated in PHS, we showed improved measures of health like blood pressure, as well as improved behaviors, more exercise, better food choices, and that these results are sustainable over time. We know that socioeconomic status makes a difference. We also know high screen time is associated with less physical activity, and that the environmental changes like the fruit demonstrations support improved behaviors. If students have one poor measure of health, it is often associated with additional poor measures, and gender differences exist. And then finally, collaboration is key to success. So next slide. So this slide is interesting because it shows data on the left from the CDC and data in the right pie graph from Project Healthy Schools. So the blue areas in the pie graph are students of normal weight. Now from the CDC data, these students were ages 2 to 19. Yellow areas are overweight, red areas are obese. On the left pie graph is CDC data, and the right pie graph is PHS data. And remember, PHS is just 6th graders, very similar, disappointingly so, in the proportion of students who are both overweight and obese. And in fact, in Michigan, there was a slightly higher proportion of students who were overweight. Next slide. We know that when the students participate in the Project Healthy Schools, that measures improve. And these physiologic measures are things like blood pressure and cholesterol, good cholesterol, bad cholesterol, and glucose. And next slide. And behavioral measures improve as well. So they participate more in moderate and vigorous exercise, watch less TV, and less video games. Next slide. The good news is these results are also sustainable. So one of our students, Nicole Corvu, a couple years ago, followed a subgroup of patients out 4 years. Now it's a small group of patients, but she was able to show that the favorable changes we saw in things like cholesterol and blood pressure were sustained over time. So we viewed this as very good. And the same was true with the behavioral measures. So more exercise and better food choices. Next slide. Socioeconomic status makes a difference. And this is something that we've looked at in the 18 years we've been doing this. So we can't ask students, obviously, what their median family income is, but we are able to look at this through school districts. So what we did is we lumped the school districts together that had a higher median family income, therefore had more resources, and then compared them to the school districts that had a lower median family income and therefore less resources. And even at the outset, the students in the lower economic status school districts had a higher proportion that were obese. That's what the bars show, the yellow bar versus the blue bar. When these students responded to the questionnaires, they reported higher consumption of fast and fatty foods and sugary beverages, lower participation in PE classes and sports teams, more sedentary behaviors, and more overweight behavior. Next slide. The good news about this is that those students in the lower SES school districts actually had reported more favorable changes. So those students, when we asked them, did anything in your life change because of something you learned from Project Healthy School classroom activities? The students in the lower socioeconomic districts reported, yes, they ate more fruits and veggies, got more exercise, less sugary beverages, and less screen time. Next slide. We also know there's a difference in screen times. So another one of our students did this project, and looked at passive screen time versus active screen time. So passive screen time was defined as television, so sitting in front of a TV, eating popcorn or chips. Active screen time was computer or video games. Hands, are busy doing something else besides dipping into the chip bag. So those passive screen time was associated with less healthy measures when compared to active screen time. Next slide. Environmental changes really make a difference. So the environmental changes that Melissa alluded to were things like the fruit demonstrations at Pathfinder Middle School, also running races, bulletin boards, changing out beverage machines for water, all those types of things. So what we did is we looked at the schools that reported making the environmental changes versus those schools that did not, and found that the students in the schools where the environmental changes were made reported eating more servings of fruit, less sugary beverages, less servings of sugary or fatty foods, and more sessions of moderate physical activity. Next slide. We also know that if a student has one measure of an adverse risk factor, let's say elevated blood pressure, they often have others as well. So students with abnormally high blood pressure for a sixth grader, adjusted for that time in their lives, they are often overweight, have higher cholesterol levels, higher random glucose levels, and less healthy behaviors. Next slide. And Melissa said collaboration is key, and this is a busy slide, and I left it in there on purpose because there are so many groups of people and individuals involved, and hundreds of volunteer hours that have gone into this. And I am eternally grateful to everyone for this, because it's allowed all of us to do this really important work. Next slide. So in addition to our evidence-based data, and I've only shown you a portion of it, there's certainly much more, and it adds to the growing body of evidence of how beneficial this program is. One of the things Jean's team did was had a survey, a process survey in some of the schools, where they asked the students, okay, you've been through the program, you filled out all the questionnaires, may or may not have gotten your blood drawn and done all that, but tell us what changes you've made since doing this. And this I find very encouraging, because the students reported 50% said they eat more fruits and vegetables, 30% are more physically active, they spend less time in front of the screen, they make better food choices at fast food restaurants. 14% choose less sugary foods and beverages and are more aware of how to be healthy and why it is important. And I love the line at the bottom, 71% shared what they learned in PH lessons with their families. So we're not just impacting sixth graders, this is their siblings and parents as well. Next slide. I am going to end with a personal story, which is a human interest story, let's say. So this is about Faatimah Raisa, who goes by Raisa. Her parents are from Bangladesh, and she spent all her childhood summers there. She attended Clegg Middle School in Ann Arbor and participated in the PHS program in 6th grade. She was so impressed by this that in high school, she served as a PHS health ambassador in high school, teaching the PHS lessons to 6th graders. She recognized the need for the PHS curricula in Bangladesh, which was experiencing a sudden increase in obesity and juvenile diabetes. She applied to our MCORRP internship program and was accepted, and spent the first summer adopting the PHS curriculum to be culturally appropriate. So by that, I mean, we had to take religious fasting, the exercise stigma for women, no places to exercise, different foods, all of that into account. And she worked with the wellness team, specifically Ben, and also one of our PhD nutritionists here to adapt this program. She was also a student at Indiana University at the time, and transferred to the University of Michigan, so she continued working on this project. As an undergraduate, she received multiple research grants from various funding sources to pilot the program in Bangladesh. So she spent 2 summers there, including one summer with several other students, and met with the health minister of Bangladesh. He was so interested in the program that he asked Raisa and her team to develop 2 additional modules, one about smoking and one about COVID. She and I have been friends for 10 years. And at the beginning, she had told me her personal goal was to attend medical school. And as she grew throughout this program, she decided that the best way to make the impact she wanted to have was by changing and affecting policy. So she is currently a law student at the University of Michigan. Next slide. So this is Dr. Eagle's favorite quotes, and one of mine, which is, never doubt that a small group of thoughtful, committed people can change the world. Indeed, is the only thing that ever has. And that's it for me. And thank you so much for listening.
Eva, fantastic. Fantastic. Thank you. I've had the pleasure of working with Eva for 25 plus years, and she is just unbelievable. I have such respect and admiration for you. I wanted to just offer a couple of reflections on what she and Melissa have said. The research part of Project Healthy Schools has always been about understanding where the program impact is and trying to improve it. This is a community university collaborative. It's not a university studying children. It's a community university team trying to identify ways of promoting health behaviors that make a difference in kids and measuring those effects in such a way that we can feel confident that they actually work. And so all of the research has been targeted to that end. And this allows it to pass muster with families and parents. The last thing they want is their child to be a research subject at the University of Michigan, but they're very much interested in the health of their children and ways that perhaps we can work together to improve that health. Melissa mentioned the 75% retention. That's a really important number because right now our model, working with Blue Cross and other organizations, is our team goes in and in a year, we try to introduce the program, and in the next year, hand it over to the school and the wellness champion and the people that will advocate for the presence of the program going forward. And then we continue as an umbilical cord to support the program, but the school is supporting their own work. This is obviously important for the program to go on. It also, I think, reflects the notion that every school has a unique culture. Every community has unique aspects that may be brought to bear on childhood health in that community. And our goal isn't to impose what we think is the right program, but rather to partner with schools and entities around those schools to make a difference. And that model has worked. And I think largely because we recognize that there's a lot of talent and organizations in every community, that the people who actually work with the children directly often understand what kind of enrichment programs will work, whether it's a volleyball club or a chef cooking class or having their own garden. All of those aspects of what I would call enrichment are based on local expertise and interest. And I guess the last thing I'll say is that this program has been funded by individuals, foundations, companies. The University of Michigan has been part of it from the beginning. And we need your support. The ability to continue and then expand Project Healthy Schools is entirely dependent on our ability to successfully implement and demonstrate the effectiveness of the program and have partners join us with financial investment in what we're doing. And I think that brings up Giving Blueday, right? Do we have a slide on that? Yeah, Giving Blueday. So in March, you would have the opportunity to participate in Giving Blueday, in which you directly potentially could make a difference in our work, or if you know other organizations or people that you think might be interested in Giving Blueday, please join, because you're part of a team that's trying to make a difference in our kids' health. And they're our future, they're precious, and every dollar we raise to help the future of our students in Michigan is critical. So let me then stop, and I will offer the mic back to Colleen, who I think is going to help us process questions.
Absolutely. Thank you, Kim. And I just want to mention that for the Giving Blueday, if you haven't seen it in the chat box, there is the Project Healthy Schools Giving Blueday link that you all can copy and then save. And believe me, we'll be getting that to you again before that date, but we just wanted to make sure that you had that. And before we start the Q&A, I know Melissa had wanted me to mention one more slide. Melissa?
I'm going to just make mention of, for everybody to kind of just put it in the back of your minds, and we'll make sure to send out an update to everyone who was here today. But coming this spring, hopefully within the next month or so, building healthy communities. We've mentioned our partnership with the team over at Blue Cross Blue Shield of Michigan. This spring, we will be again opening our request for applications for Project Healthy Schools, as well as other programs that are under the umbrella of building healthy communities. And if you got a glimpse at Eva's slide of all of our partnerships, we know that BHC has numerous community partners that work with Michigan students from kindergarten all the way through high school. And so we're part of that program that works with our middle school students. So just a little PSA to keep an eye out for that RFA. So if you have a middle school in mind that you would love to join the PHS family, we would love to get the name of that school. We do have a follow-up survey for everybody who's attended today, and you'll be able to put that school's information in that if there is anybody in mind. And so just to kind of piggyback off of talking about community and all the great information that Eva shared, When a school has a positive and inclusive, engaging environment where students feel supported through physical activity and nutrition and mental and emotional health with our partners with Trails, it doesn't just enhance the school day experience for students, but research continues to show us that it has an actual causal relationship when it comes to student health and academic outcomes, which can include things like improved attendance rates, improved standardized test scores, and again, graduation rates. And so students learn knowledge from our curriculum and then attain the skills that they have at a younger age. We also know from research that those skills and that knowledge then carries over into adulthood. And when we have those healthier habits as adults, typically means that we're healthier and as adults, we're healthier employees, which means more productive employees in the workplace. And so it's not just beneficial as students, it can be beneficial in the long run as students grow and develop. And so, again, that starts from kindergarten all the way through high school. And so wanted to just emphasize it, of course, we want to improve student health outcomes, but Project Healthy Schools, the programs under BHC do a lot more than just improve health outcomes as well. So I'll go ahead and click ahead and hand it back over to Colleen. Thank you for letting me interject, Colleen, to open up the floor for any questions, if anybody has any.
I'm looking back in the chat, and Eva, I think it's more of a comment, but maybe Eva, you can speak to this one. It was Dr. Bobby Makamala who said perhaps using percentage on free reduced lunch list would be a useful metric as well. Would you like to speak to that, Eva?
Yeah, sure. It is something that we've looked into, and I know that we're using it for a current project that we're working on. We're looking at percent overall of free and reduced lunches in a variety of different schools and comparing those. So thank you for that comment. And yes, we are looking into that. And I did want to mention that, speaking of lunches, the NIH project, which we're working on right now, is very exciting. So there was a team that was interested in looking at the effect of COVID and students' access to lunches. So we are working closely with them and going to be conducting some interviews with the nutritionists in the school districts to see what happened, how many free lunches were actually distributed and picked up, and how did this effect of the COVID and the school closings affect students' access.
Excellent, thank you. We just had another question. I know that Jenna Beckelor from Ann Arbor Public Schools wants to know to restart the PHS partnership. And Jenna, I just put Jacob Robideau, he's your wellness coordinator, and he can go ahead and contact you and get things going from your end again. I think that's awesome. We also had Dr. Makamala again with another awesome suggestion for us about working with the Community Foundation Flint. So thank you so much for that. We appreciate that. And Rachel says that I can provide some background about how schools initially handled the free and reduced lunch. So we love all this. Thank you so much, everyone, for your support. Anything that we can do to help, anything that we can do to collaborate, we are absolutely excited about doing that. Are there any other questions or suggestions that you have?
Colleen, Kim again. I just wanted to thank Bobby for his leadership in the Flint area. He and his wife have been amazing advocates for the health of all of Flint's residents, but they've also joined us in our work in PHS in that community. It's really gratifying to work alongside people like that. And I know there are a number of other people on the call that have been part of our individual community efforts. And for every one of you, I can't thank you enough.
Great, thank you. So there was a question about making a gift to specific school districts, and the answer is yes, absolutely. Question from Gwendolyn, do you work with school nurses? Well, there's not a stellar percentage of schools in Michigan that have school nurses, but it has increased during the pandemic. And I'm going to let Melissa speak to that one.
Yes, Gwendolyn, thank you so much for your question. And absolutely. And so we are happy to work with school nurses. We have a great team at the university, the Regional Alliance for Healthy Schools, where they actually have school-based health clinics, and they've been a partner of PHS previously. And so we're more than happy to offer our curriculum and services and support to school nurses. They can also help if there's more of a direction that you like to go in terms of actually offering kind of those health related services, clinical based services. We can also connect you with the team over at, we call them RAS as well.
Great. Okay, any last questions before we wrap up for the day? And Dr. McConnell put also possible that COVID relief dollars available to schools, and there's a link in there for folks. Jim Dent wants to know, in as much as you are in front of so many students, have you talked at all about the importance of COVID vaccines? And Melissa, that would be for you.
So we do have our, we haven't had any COVID vaccine specific curriculum at this moment, but we do have our curriculum that's based on infectious diseases. And so that's something that we communicate to our students that, you know, how it's spread, how we can mitigate that. And so we don't have anything specific to that yet, but definitely, you know, can look into seeing if schools are interested. We're more than happy to help with that.
Great, thank you. And we do want to give you all at least a moment or two at the end so you can do a little self-care, stand up, move, whatever it might be. So right now we're going to turn it back to Melissa so she can wrap things up for us today.
Thank you all for your attendance today. I will go ahead and put my email address in the chat box in case you have any follow-up questions for us. And that's not even the right email address. I pushed enter too soon. And so with that, again, there will be a follow-up survey just to get feedback from everybody for this morning. Again, if you have any schools, even if you just have the name of school, don't have a contact, as we gear up to start getting our request for application out with BHC for the next school year. So this would be for the 2022-2023 school year. If you have any schools in mind, we would love to reach out to them and see what types of services we can provide, whether it's PHS ourselves or if there's another BHC program that would be beneficial for them. If there is anything that, anything else that you think of, you would love to support Project Healthy Schools with, any ideas in terms of what your school may be needing, we're more than happy to have that conversation with you as well. So thank you all again so much for your ongoing support of PHS. Hopefully you save that Giving Blueday link, and we will be sending out just a quick reminder about Giving Blueday in the next few weeks to make sure that you save that. Again, thank you so much. I know time is precious right now, especially those of you who are in school. So thank you all for your time. And we look forward to communicating and chatting with you again, hopefully before next year's community conversation. So thanks again, everybody.